right, so Senator Ron Johnson thinks to get to a consensus on health care, the country needs to start talking about how it actually works, what the details are. I know it sounds like broccoli. I don't want to do the homework. Well, too bad. This stuff matters. And we asked him, come on, bring on your math, bring on your charts, and let's have a real discussion about how the senator believes you could repeal and replace Obamacare and make it better for people like you. He joins us now. Senator, thank you very much. Let's get through some of your big points.
So this is the morning broccoli here, huh? Well, let's start with just the basic fact of what our healthcare system is. We spend about $3.2 trillion. You know, the largest percentage is in hospitals, doctors and clinics, home care and nursing. That's about 2/3 what we spend. Insurance, administration, and drugs is about 20%. And the point I'm trying to make here, because I hear it all the time, well, if you just get rid of the profits from drugs and insurance companies, you'll solve the problem. Well, we've done a pretty good job at estimating this. We think it's about $135 billion out of the $3.2 trillion, 4.2%. So you can take away the motivation of innovating from drug companies and not have new drugs, and you still wouldn't solve our healthcare problem.
Right, but also, you can't take profits out of a capitalist society.
I don't think you should. So again, I just want to dispel the myth that our problem isn't profits in drug companies, insurance companies. The problem lies in an inefficient delivery system fueled by the fact that, you know, people really aren't paying for it, but we'll get that in the next chart. Let's just take a look at how basically people get insurance. The vast majority of people are employer-sponsored group policies, largely unaffected for the time being by Obamacare. But again, Obamacare is primarily Medicaid expansion for able-bodied, working-age, childless adults, putting at risk, from my standpoint, traditional Medicaid for the elderly, disabled, and children. Obamacare is primarily about the individual market, a very small slice. About 5% of the American population is in the individual market, and yet Obamacare's faulty architecture was causing that small slice of the American population to bear the full social cost of covering people with high costs from pre-existing conditions. It didn't work. Now,
but wait, hold on a second. Just to make some points that matter. First, on expenditures, just quickly.
Yep.
Yes, you can't take profits out of capitalist society. True. But you can go at the businesses about what they're charging and why these costs are so high, specifically on drugs. I know you want to work on that.
Right.
You know, why are they charging so much for these drugs? It's not about their profits, it's about what they put into the cost structure.
Because we've taken consumers out of the equation. Back in the 40s, 68 cents of every healthcare dollar was paid for by consumers, the patient. 32% was funded by insurance and government. Look what's happened now today. A little over a dime, 11% now is paid for directly by the patient. The rest is covered by government insurance. So the fact of the matter is, because you don't have consumer-driven price competition, where consumers are demanding, first of all, to know what things cost. They don't know, they don't care, because somebody else is basically paying. Now, we care deeply how much we pay for insurance, but that is so far removed from what is actually happening at the provider level. And so, again, consumer-driven price competition works in every other area of our economy.
I know, but this
doesn't work in healthcare.
Except that healthcare isn't like anything else, right?
Right.
The idea that competition will make it better. We haven't seen healthcare that has been greatly improved from a cost perspective because of competition. People need healthcare.
Chris,
it's much more expensive. It's something you need, even if you think you don't need it.
Obviously, you're not going to go and price out what happens, you know, for provider when you have a heart attack. But when you're getting LASIK eye surgery, you do, and so the result of that consumer-driven price competition, the quality of LASIK eye surgery is increased, the prices come down. It works. It'll work in a large segment of our healthcare system, not 100%, maybe 50, maybe 60, but that would really restrain costs. Look at what happened with HSAs, health savings accounts, because people had higher deductible plans. CVS, Walgreens, Walmart developed walk-in clinics where you can go in and get your kid's ear infection diagnosed for $35 versus the emergency room at $200.
Right, but that's another thing that factors is that, one, healthcare savings account is only good if you have the money to put into it. Two, one of the reasons you've seen a big change in this metric is that healthcare is so much more complex now. It used to go that if you had to get your appendix out, God forbid, they went in there, they cut you open, they took it out, and that was it. Now they have all these tests and things that go into everything, so you're getting more care and there's more cost.
We have endoscopic surgery, which actually reduces cost because it reduces the hospital stay. I used to supply that market. But let's go on to what I was continue to emphasize about the faulty architecture and what Obamacare caused. The first chart here shows what the trend line was in premiums prior to Obamacare. Back in 2013, an average American about 40 years of age was paying $232 per month. Because of Obamacare, this is according to HHS, premiums increased 105% nationwide, up to $476. And here's the new trend line. So we doubled that trend line in health care. And one thing I laid out for our Senate colleagues who were crowing about the fact that, hey, the Senate bill would reduce premiums 30% to the trend line, we're still not bringing it down to where we should if we actually did a root cause analysis of what caused this trend line to increase. And we have the answer on that because HHS commissioned a study by McKinsey. Here's just one example, Tennessee. Their premiums tripled in Tennessee for a 40-year-old male.
Non-expansion
From $104 to $431.
Non-Medicaid expansion state.
Precisely. But here's the main cause. Insured risk, which is guaranteed issue covering people with pre-existing conditions, and community rating. Chris, here's the good news. You can actually cover people with pre-existing conditions like Maine did. They didn't even repeal guaranteed issue. They supplanted it with invisible high-risk pools. This is what their premiums were prior to implementing invisible high-risk pools. This is what they went to. This is a third of what it was prior to. That's about a half.
But
So they cut premiums in half to two-thirds by instituting an invisible high-risk pool.
Which is a great phrase, right? Invisible high-risk pool.
Well,
but there are two things.
Pools.
One, they put an assessment on. It was like $4 per person. And two, they have a different demographic perspective than you have in the country overall. That's why Susan Collins, one of the senators from Maine, said the money that you're putting into the Senate bills right now to try to affect what they did in Maine is not nearly enough.
Well,
you need much, much more money. It's very expensive to do high-risk pool.
Well, this shows it works. We had a high-risk pool in Wisconsin, worked very well. We can work on the details of that, but the point being is what Obamacare did is forced a small percentage, about 5 to 6% of the American population, to bear that
disproportionate cost.
That full social cost of covering people with high-cost pre-existing conditions. What I'm saying is spread it out over everybody. Through an assessment. That's how Wisconsin's high-risk pool was funded. Premiums plus assessment on insurance companies, which they spread over the rest of the population. It's a fair way of doing it without tripling insurance premiums. Which, again, if you make too much money, these are the people Bill Clinton was talking about, the people busting, working 60 hours a week, their premiums have doubled or tripled, and their coverage cut in half. But that's unfair, and they were the forgotten men and women of Obama.
It is, but there's one question that we can take up the next time, which is you seem to be making a very strong case for what needs to be fixed, but why do you have to repeal and replace what's already there when a lot of it is working to deal with what you admit in two different charts is a small slice of the people affected who are being disproportionately hit by costs? Why not fix that and not scrap the whole thing?
Because it was guaranteed issue and community rating that caused premiums on a national average to double, in Tennessee triple. We need to address that honestly. Now, we say repeal so you can fully replace it with something. So maybe it is fixed. I've been talking quite some time. Repair the damage done by Obamacare.
You guys wouldn't talk about fix.
Well, I did. Okay, I was talking about it all the time. So repair the damage done by Obamacare and start transitioning to something that works, which is what I'm going to use my committee for over the next few months, to lay out these realities, hearing after hearing, do a problem-solving process, start the information, define the problem, lay out the reality, set achievable goals. This is an achievable goal, Chris, which we completely ignored during the Senate debate.
You'll have to plow through the politics because they like repeal and replace. Now you have the president beating you over the head with that promise, making it the bar. Maybe this is the way to go. Do it incrementally, fix what the problems are. We will follow it every step of the process.
Appreciate the PowerPoint. This is fabulous technology.
They're saying that John King may have competition, and it is embarrassing to me that in your first time out, you're way better at using the wall than I am. But, Senator, thank you.
I'm a business guy.
Hey, and you know what? This is an important conversation. Thank you for helping us along.
Thank you for having me on.
Absolutely. All right.